Hey, it's Chris Beyer.
Chris Bowling.
Brad Johnson here.
Hey, Brad.
Happy Bottom Line Thursday, sir.
Thank you much. Would you like to talk about hospital prices?
Of course.
I
Absolutely.
know
Of
Bowling
course.
has no opinion on these things. So, you know, this is kind of interesting, a little bit of a backdrop. If you were to ask a person, do you think charges in the Midwest generally are better or worse than average? I would I would think the average person might feel, well, you've got more rural areas, probably not as expensive, and that's kind of where I was on this.
Right.
There's been this study, it's called the RAND study, among others, that look at what hospitals charge as a percentage of Medicare. So if Medicare
Right.
charges $100, are they charging two, 300, that type of thing? Well, it turns out Indiana, of all places, is top 10 in the country. In fact, number eight of the
Jeez.
country. That surprised me a lot. I
They
could see
think they're
maybe
real special.
Indianapolis. Yeah, you got all those rural
That's a pretty
spots.
rural state when you get out of the metro.
Right.
Yeah, it is. I mean, maybe take an Indy 500 car and get you there quicker. But so that was surprising. But I think all of us have learned, throughout the years when reference-based pricing kind of became the latest
Yeah.
thing to check out. Indiana was one of the first to do it, and likely because their hospital charges were so high. That's kind of waned. Byron, you had
Yeah.
mentioned that you're seeing Chris, or that you're seeing direct contracting take
Yeah.
off there
Yeah.
Huge in
because of this
Indiana. I mean, it's
reason.
probably the most built out state for a
Huh.
direct contract network that we've seen. Lots
Yeah.
of direct primary care clinics. I mean, it's just they've embraced that quickly.
And the latest thing, and they have a Republican governor, they are now limiting what hospitals can charge patients on employer plans to the
Ooh.
non-profit, some of the largest nonprofit hospitals. They're new
Oh,
Wow.
price caps. And you kind of think politically, that's not typically something you'd see on the Republican side of things. This is
Yeah.
not meant to be a political uh, broadcast, but just it's kind of an interesting
It's
thing that
typically less, regulation is the theme. Yeah.
correct. And
That's interesting.
yeah, and so if they fail to meet these targets, the governor's threatening to pull their tax exempt status to the nonprofit hospitals.
wow.
So,
Wow.
yeah, we'll see. We'll see if other states follow suit, but that
Man.
was the first I had
I,
heard
Now,
of.
I need to make my disclaimer that Chris and I work with multiple rural hospitals that we think are doing a good job from a pricing standpoint. But what I'm recognizing as we've talked to them, if they're the only option for care in a county, and that's many of them, especially in the state of Illinois, they have no choice but to charge what they charge to commercial plans because their Medicare, Medicaid population is so high.
so high.
As we've brought that concept to them, would you do a bundled arrangement for these employers that are in your community? And we can't adjust our pricing. We're dependent on the commercial
Yeah.
insurance to hopefully help us break even to cover the government programs. But what's interesting about that, most of those are not your traditional nonprofit. They're a governmental entity. So
Right.
nonprofit status, but they're not a nonprofit organization. They are just a county hospital, a hospital district, but very eye-opening for us to see why they have to charge what they charge to just keep the doors open and keep healthcare in a certain county.
Yeah. Man, their margins are tight.
Yeah.
And that makes a lot of sense. So, going back to who would have thought
Oh,
Indiana
yeah.
such a disparity, but that would make sense if you only have 40% of your population, Medicare, Medicaid, 60% commercial. Okay. What about 70 or 80%? I'm making up those
Yeah.
numbers.
Right.
Yeah.
That
Right.
means the amount you can pass along to commercial has to be
That's
significantly
tight.
higher.
Yeah.
I would be curious to know how many of those under scrutiny nonprofits are a rural critical access style hospital or
Mhm.
a large system with nonprofit status in a metro area. And I mean, those are two distinct models, but all
Yeah.
technically tax exempt.
Mhm.
Yeah, I think it's more the latter. They were names
Yeah.
that I was familiar with, and I can't say I see care in Indiana. Let's see here. Ascension, St.
Okay.
Vincent, Community
Yeah.
Health Network, Franciscan Health, Indiana Health, or Indiana University Health, and Parkview Health. I'm not familiar with that last one, but I think these are large corporations or entities, and
Interesting.
yeah, and it kind of going back to There was a very well-respected business owner I had talked to years ago that served on some boards of some hospitals. And he said, you know what? A lot of times it's just a tax status. It doesn't mean that they operate differently.
Sure.
Yeah.
And that's true in anything, right? There's businesses that pick the best, most advantageous tax status, and they can go with that. So I think they're really targeting maybe not so much critical access on this.
Yeah.
I
The
think
big
they are
systems.
targeting the big ones that just so happen to have a favorable tax treatment.
Well, let me be Chris Bowling and bring in the contrarian view and the Debbie Downer today. I appreciate you, CV. Okay, so you lose your nonprofit status. Big hit. Now you're for profit, and what do? You just charge more
Right.
to make up for it. Like, again, let's control it. Let's make sure they're in line, but you flip for profit and just then you increase your billings further. Like, this isn't a fix.
It's not
Yeah.
a fix.
For every
Was that
action.
good, CV? Did I do that justice?
I loved it. You could have gone further to say, once again, we missed the mark on the Affordable Care Act. There's nothing affordable about the Affordable Care Act.
It's all access to care.
It should have been called the American Access Act because it's how you're accessing healthcare. And we've all talked about this. Within that bill, if they would have just said all commercial insurance will be X% of Medicare, period, we would have created competition. We could have created multiple carriers fighting for clients, where right now the big houses get the biggest discounts.
Yep.
We missed the mark on how to make healthcare affordable because it's not, it's just
Yep.
getting worse.
Very true.
Yeah. Well done.
Yeah. I did my best. I did my best.
I was gonna say you pick up some pointers from that ACA commentary buyer. So
Yes, it's noted. It's in my brain from now on. So, no, thanks again, Brad.
Thank
Another
you,
good
Brad.
talk.
yeah, I'll talk to you later.
We'll see you, buddy.
All right.
Bye-bye.
See you.
Bye.